Okay, I'm going to get us started. My name's Corinne Waldow. I'm the Economic Development Director for the Boulder Chamber. And I want to thank you for joining us for this week's Outdoor Rec and Personal Rec conversation. We're going to continue to have opportunities to ask your questions, give feedback, and get updates on orders, on Boulder County's current situation, epidemiological data, and so forth. But the schedule will be changing starting next week, and we'll go over that at the end of the session. If you have questions throughout the session, please put them in the Q&A or the chat, and we'll ask them on your behalf. And I want to thank you for being here. Thank you for getting your questions answered. And thank you for your safe reopening practices as we continue to move forward. At this time, I'm going to hand it off to Mary Olson with Boulder County Public Health.
Hi, everybody. We're going to be going over the following items today. Just looking at the long-term outlook for the virus in Colorado. Continuing to review our public health orders and the face covering order, and giving you as many resources as we can, as well as some recreation-specific information. As many of you know, as we all know all too well, the long-term outlook for the virus is that it's here to stay. The public health orders that are mandatory in the state of Colorado are going to be with us for a long time. And this is our new normal until we have a vaccine, treatment, or herd immunity, and that will likely be months, if not longer. The state of Colorado has seen a couple upticks in cases, but the county is still pretty stable, but we still have to be vigilant. We are at over 3.5 million cases in the United States, and looking at over 13 million worldwide. So this is, again, a menace that we are going to have to deal with for a long time. An update on epidemiology. Please, if you do have an outbreak at your facility, do follow Boulder County Public Health protocols. Those are on our website that we will link you to in a little bit. But we also want to just encourage you to follow those protocols, and at the same time, you don't need to unnecessarily subject your employees to testing. So if you have a case, if you have an employee with symptoms, you should just be following all of the protocols that have been in place already, having those employees isolate at home, and making sure that you continue to monitor symptoms. But we don't need to continue to test employees once they have tested positive. So relying on hopefully the systems you have in place already with your workplace coordinator, where you can monitor those symptoms as you have been all along. We are still in the safer at home phase of our public health orders. We're still working from the 8th revised order from the end of June. And that order will remain in effect even if we do move into the next phase, protect our neighbors. Obviously, we will continue to see revisions as needed, and certainly things will change if our case counts really increase in the state. The Protect Our Neighbors phase is the next phase of the public health response in Colorado. Communities must qualify and apply for that phase. And of course, the county will be trying to move into that phase when and if we can, but at this point, we don't know when that will be. So we are still in the safer at home phase and following all the safer at home guidelines. We have been sharing this slide with you for a couple weeks from the state website, encouraging you to choose activities that are less likely to transmit the disease. So for recreation, we are all over the map on this chart. At the low risk end, we have outdoor recreation, camping, lodging, and hanging out in a tent. You're pretty safe. As you move up the scale, being out at a playground, swimming, those activities are riskier. And then at the very high end of the spectrum, we have gyms. So that is not to shame gyms, that is just to make you aware that there is more risk there, and that we need to encourage you to continue to really follow the 3 big guidelines: wearing face coverings, washing hands, and maintaining 6 feet of physical distancing, along with cleaning and disinfecting your facilities. Do you have activities you can move outside? According to one rather random study, you are 19 times more likely to contract COVID indoors than you are outdoors. Again, this is just one study, apparently not peer-reviewed, but we have all seen some of these studies that demonstrate that being outdoors is just safer. So if you have activities at your facilities that you can move outside, we encourage you to do that. And here are some examples. Moving break rooms outside. Obviously, restaurants have moved a lot of their seating outdoors. Having any meetings outdoors is great. And you can even go to a drive-up concession stand, which I thought said concession stand, but no, you can really go see a priest and tell him your woes, or her, I suppose. Face coverings, we talk about these every week, and it's going to be a big theme this week. It's just really important to wear a face covering along with social distancing and hand washing. This is what makes our community safe. It makes people know that we are a community, we care about each other. So it just sets an awesome example of that, as well as protecting our vulnerable populations. So specifically for recreation, that really means encouraging, urging face coverings for your employees, for yourselves, and really making sure your patrons are doing the same, especially when they're in a situation where they might be passing each other or entering or exiting the building or gathering in any way. The Boulder County face covering order is in effect indefinitely. We will link you to our face covering script, which helps you deal with patrons that may not have a face covering on. And then just make sure to check any local ordinances that might be stricter. The stricter ordinance always applies. And this is just a tidbit from Goldman Sachs. They did an analysis that showed that if we had a national face covering order, it could potentially substitute for going back to full quarantine that would otherwise subtract, and that, going back to quarantine and full lockdowns and closures would potentially subtract nearly 5% from our gross domestic product. So huge financial impact, and a face covering is a pretty easy way to hopefully allow us to prevent going backwards. Obviously, there's a huge emotional impact and health impact as well. So it's all about those three big things: face coverings, physical distancing, and washing hands. Okay, one more study to share with you. This is a study that was released in a scientific study that was released in the Physics of Fluids journal last month. And I just want to note that this is not an epidemiological study, but rather a flow visualization study that demonstrates the effectiveness of wearing masks versus not wearing masks. So this is how they set up the study with a mannequin and several different types of face masks, and then using a pump and a smoke generator along with a laser shield to capture the imagery. This slide shows a simulated cough that had no mask, so unobstructed. And you can see at this scale that those droplets, those respiratory droplets, are traveling up to 12 feet in under a minute. So that's what it looks like without anything on that mannequin. Moving just to a very simple folded handkerchief, we've changed scales here, and within a couple of seconds, those droplets are only traveling about 1 foot and 3 inches now. So huge difference with just a simple folded handkerchief, going back to that 12 feet of travel here in under a minute. And now at 2 seconds, we're only, well, I should really compare the seconds. So that first image, we've got 3 feet of travel without a mask in 2 seconds. The next image, we're down to about 1 foot in 2 seconds with just a simple folded handkerchief. The homemade stitched mask with a couple layers of quilting fabric yielded the best results in this study. At 2 seconds, the respiratory droplets are only traveling a couple of inches, which is really amazing. And then the last mask they used in the study was your over-the-counter cone mask. You can see there's a little more leakage with these, but again, pretty effective. After a couple seconds, I think the average jet travel was about 8 inches with this, and I did add the table here that shows those results. So again, this is just one study demonstrating the effectiveness of having or not having a face covering. Uncovered average jet dispersal is at 8 feet when you cough or sneeze. A bandana, not very effective, but does cut that distance in half. Folded handkerchief, we're down to 1 foot and 3 inches of travel, average travel of those respiratory droplets. And then again, that homemade stitch mask is really the winner here at only 2.5 inches. A commercial mask doing pretty well at 8 inches as well. So again, this is just one study, not an epidemiological study. This does not really show or demonstrate disease transmission, but we can see that wearing a face covering really does decrease the amount of respiratory droplet dispersal. Okay, after all that science, we'll go back to our guidelines on recreation. So again, it's still operating on that 8th amended public health order that came out at the end of June. Everything that we talk about here always goes hand in hand with physical distancing of 6 feet, wearing a face covering as much as possible, and always wearing a face covering when you cannot maintain 6 feet of physical distance. Gyms, recreation centers, pools are all open at 25% capacity or up to 50 people, whichever is fewer per room. We do encourage that sharing equipment is discouraged when that's not possible and people are sharing equipment. It needs to be cleaned and disinfected between each use. Your restrooms and showers are open. We are asking that you close off a series of lockers to help with physical distancing. And then moving into the outdoors, again, we are keeping our distance from people at least 6 feet and wearing face coverings as much as possible, and always when you cannot maintain that distance. Outdoors, any activity is allowed with 10 or fewer people for recreation. Boulder County has specifically allowed fitness classes outside for up to 50 people. So again, anything you can take outdoors safely and with physical distancing, go for it. Swimming pools are open at up to 50% capacity or 50 people, whichever is fewer. They must be cleaned and disinfected frequently, all those high-touch surfaces, any shared objects. Bathrooms must be cleaned hourly. Playgrounds and outdoor sports facilities also open, but only up to 25 people on your tennis courts, pickleball courts, etc. Again, any high-touch surfaces or shared equipment must be cleaned and disinfected frequently. And then a few more things on the outdoors. Organized youth and adult recreational sport leagues are happening and allowed for groups of up to 25 players. We do ask that you maintain records and contact information for your players and your teams, just in case you have an outbreak and you have to do contact tracing. Also, we're urging you to decrease the time between games with other teams down to every 2 weeks, if possible, again, to reduce disease transmission. And of course, no sharing of snacks or water, and encouraging personal equipment whenever possible. Spectators are discouraged for adult sport leagues. They are allowed for youth sports, but again, as always, with physical distancing between households. Okay, here are all of our links that we try to give you every week. The Boulder County Public Health website, the state's website, Energize Colorado, the Chamber is here for you. And then of course, any professional associations you may be affiliated with. And just a reminder to always check in with your local municipality if you have specific questions regarding local ordinances. Like Corinne mentioned, we are changing and shifting to a new schedule next week. So there will be a couple of webinars on Wednesdays, a general session at 3 o'clock, and then we're reserving a slot for any special topics we might have. And of course, we will continue to offer a Spanish language session in collaboration with the Latino Chamber, and that'll be coming out on Thursdays. And there's a link to that information there as well. And always feel free to reach out to us if you have any concerns or questions. We're here for you. You can email us at covidbiz@bouldercounty.org. And our call center is now open from 9 a.m. to 2 p.m. Monday through Friday. And that's all I have. I'll hand it back to Corinne for any questions.
Thank you, Mary. That was great. Thank you. We only had one speaker this time, but you did a wonderful job of summarizing all those studies that just have the general point of masks are better, outside's better, distance, masks, hand washing. I think we all say it over and over again. We've heard some businesses say that individuals are walking in with a little card with Boulder County Public Health logo on it saying they're exempt from masks. Either you or Jesse can answer, is Boulder County Public Health issuing those cards?
Do you want me to?
Go ahead, Jesse.
Go ahead, Jesse. I'm not aware of that.
Yep, exactly right. No, we are not issuing cards. We will not issue cards. The best thing you can do is look at the face mask or the face covering script to see if you can navigate them to another way of getting in if they really don't want to wear a mask, but we are not issuing any sorts of exemption cards.
Okay. So a little bit about the face mask orders. We know that some municipalities have stricter orders, and which one do you have to follow? I know Boulder, the order is from the state. Boulder County has an order. Louisville has an order. Which order do you follow as a business?
It really just depends on where you are. So no matter what, whichever order is stricter applies to you depending on where you are. So if you are in the city of Louisville, which does have a stronger face covering ordinance, you need to follow that order. If you're in the city of Boulder, you are following the county's face covering order. I think that's right. Is that right?
The city also has a face covering order.
Okay, so yes, it really depends on where you are.
Right, but
we do send out a chart that kind of shows, if you're in the city, these are the required for customers and employees. But it has made a difference in, for example, gyms. If you're in Louisville, most likely all of your guests are wearing a mask the whole time, because their order requires face masks indoors and doesn't have some of the same language that the county has. So when I go to yoga in Louisville, I'm doing it with a mask on.
Correct.
So then we are in a very hot month. Right now, maybe not so much. And Mary, you and I were talking about how it's a little cooler today, but it's 99 degrees outside and people are walking in and you're taking their temperature and it's a little elevated. What's that number? What's that magic number where they're not allowed to come in? And what do you do? What are some best practices to let the person cool off a little bit because of the heat outside in order to get a more accurate reading on the thermometer?
Boy, that's a great question.
Yeah, Jesse's answered it the last 3 calls, so maybe he can answer it this time.
It's getting better every time. So the cutoff temperature is 100.4. Above that, you should not allow them to enter. And you should actually ask them to go, do they have other symptoms and maybe they should go home. In terms of ways that you can, definitely if you've been walking in the sun or you're standing in the sun to get your temperature taken, you're going to get falsely high readings. And so figuring out a way at your front door or near your front door to have a shaded area, or do a second reading after a little while, after they've been inactive for a little while. Maybe have them stand under a tree. If they've driven, they could maybe hang out in their car and turn the air conditioning on to get their temperature down. What you're really doing, the sun is, and any activity is just going to elevate your temperature beyond your sort of resting temperature. So you want to figure out a way to eliminate the sun as one of the reasons that they have a high temperature.
So I was giving an example of how I had somebody come into my office, the chamber, and we took a temperature and it was 99 point something, and their eyes were wide open, like, oh my gosh, am I running a temperature? Gave it a minute or two, took the temperature 97.4. So it was almost 100 degrees yesterday. They rushed back to their car, rushed back in. And so, but if they were at 100.4, I would not have let them into the facility and, retaken it again, but at least I know that threshold, and there's a lot of questions about that. All right, let's talk a little bit about mask enforcement. What does mask enforcement look like outside? Specifically, this person hiked a trail where there's not much space on that trail and nobody was wearing masks. What does enforcement look like outside, and how can we promote more mask wearing in situations like this?
I can take a shot at this, Jesse. Certainly we do get a lot of complaints about people not wearing masks. And at this point, your first, the first thing you do is call us and let us know and submit a complaint. And we will reach out to the agency where you hiked or wherever you were, where face coverings weren't being worn. And we do keep track of repeat violations, and eventually we can make sure that there is some monitoring on site going on. Certainly, I know we've at Boulder County Parks and Open Space, we've increased having more employees on site, making sure people are wearing face coverings if we get more complaints. Beyond that, the next steps, I'll leave that up to Jesse to respond.
So, I think in terms of mask wearing outside, Mary, you're spot on. It's really down to the agency that sort of controls that space, if that makes sense. So if it's the city of Boulder, open space and mountain parks, it's their rangers who enforce. If it's parks and open space for the county, it's our rangers who enforce. They have all gone to the, mask wearing is a requirement, but there are only so many rangers for the entire county and for the entire city, and there are the thousands of acres, tens of thousands of acres that they have to cover. So they, what we're encouraging businesses to do and municipalities to do, and recreation providers, whether that be the city or someone else, what we're encouraging people to do is provide signage that just encourages mask wearing. In terms of enforcement, like Mary said, call us, email us. We can reach out to those agencies. They can refocus their efforts to certain areas. A place like Chautauqua or Ohio Valley Ranch on a weekend, there's just a lot of people in those places. And those agencies know that. And so they're going to focus their attention there. But on a weekday, on a random Tuesday, maybe they don't have a ranger out there. So us telling them, hey, we're hearing a lot of reports that on Tuesday, Chautauqua, nobody was wearing a mask, they can refocus their efforts to that area. In terms of enforcement beyond that, we really can't, it would be virtually impossible for us to enforce against an individual who didn't wear a mask outside, unless it was at a business and we could, the business reported it to us and that sort of thing. But that's why we're really focusing on the education side of this.
Well, and let me add that part of this is that we have people coming into our community, using trails that are out from outside the community where they may not have mask orders. So it's an education from businesses, from our hospitality folks, from the Convention and Visitors Bureau on the bus, to continue to say in Boulder County, we protect our herd as the slogan is going on at CU Boulder, and we're having you wear masks in Boulder County. So some of it may be just a lack of knowledge from people coming into our community from other communities where it's not required. So, continuing to work together as, public sector partners to get the message out. There was the joke of a billboard on 36 on the way in that said something like, when you come into Boulder, we wear masks in Boulder. So I think it's all of our responsibilities to continue to show that mask, to talk about the mask requirement in our area, and to communicate it to people that come into our businesses, and so forth. So I think there's just that other component. And I know Boulder County Public Health is doing a campaign where they want you to send pictures of people doing things with masks. Downtown Boulder is doing the same thing. The Chamber and Convention and Visitors Bureau, we'd love for pictures of people doing regular everyday activities with masks on, so we can continue to, when we promote the area, we use images of people using masks to do the activities. And I think that'll be just a part of all of us. So I know we look at, well, they weren't wearing masks. Well, it might be an education piece to that as well. Can you speak to the requirements for direct and indirect exposure risk definitions for business operations and reporting requirements?
I'm not sure I totally understand the question, but I think in terms of reporting or assessing the risk to employees and customers, that sort of thing, if you are keeping track of the employees in your business, who's coming and who's going, what their temperatures were, what their symptoms are, and you're asking an employee to quarantine if you suspect that they might have virus, that's a requirement from the state that you do that. And in terms of indirect exposure, I guess I'm not, really, if an employee believes that they were exposed to another employee who then had to quarantine for the possibility of having COVID-19, I would speak to that employee and find out if he or she wishes to quarantine. In terms of reporting that, you don't need to report that you asked someone who might have been exposed to quarantine. But I'm not totally sure if that answers the question.
So in a classroom, one person tests positive. Are you required to notify all who were in the class, or just those within 6 feet of that person?
I would notify everyone. You don't know how close they got to someone else as they were coming into the classroom, or whether they were together outside the classroom. It's best to report to everyone if there was a positive test.
And they're not alone. You have staff at Boulder County Public Health that helps businesses navigate these reporting requirements, the notifications, the tracing, all of that. And that's a whole nother staff that we haven't even introduced here on these calls, who help guide you through that process. So you're not alone. And so make sure that you reach out to Boulder County Public Health in those situations.
I really appreciate that comment, because there's sort of, and I think it goes to another question that I saw in the Q&A about reporting. The epidemiological team works with us, but sort of beside us. And they do get reports from testing agencies that, hey, this person who works at these places and may have seen these people tested positive. And they trace down everything about that person. They try to do all of the contact tracing and all of that. We, Mary and Olivia and I work on a team that really works with the business. And again, we've tried to mention this a couple times. but I think it constantly bears repeating. We are not interested in shutting you down if you have a sick employee. What we're going to do is get in touch with you, say, hey, you have a sick employee, you know, have you noticed any other employees reporting in sick? Here are some tools and practices that you can employ to protect your employees and stay open. And so we're trying to work that from both ends. And so one thing you can do to help is if you find out that an employee is sick, call us. We will then, I mean, that's the level of reporting we're looking for, because otherwise we get a report from either our epidemiological team or from an employee who calls and says, I'm nervous. And then we call you and go through the same thing. So we really recommend that you get in touch with us if you know that you have an employee who is either quarantining because they're nervous or is actually sick.
So this goes back to this reporting question. So an employee may test, and the county in which they live may then report it to you guys or to their employer and say someone, that works for you tested positive, even if they don't live in Boulder County. But because the business is in Boulder County, if you have 2 or more, it's considered an outbreak at your facility, and you need to report it via the reporting guidelines and the outbreak guidelines that I send out weekly or that are on your call to the county in which the company resides as well, right?
Yep.
Okay.
Exactly.
And they help with the contact tracing and some of the ways to communicate to other employees, which brings us to the next question. If a client or customer who tests positive has contact with an employee at a place of business, and the employer then tells the employee to be tested, who bears the costs of the test?
That is a policy question. There are no rules at the state level regarding that. It's between you and the employee. We definitely encourage you, if possible, to bear that cost. That'll help protect the employee and reduce the stress of that. But there are no rules regarding that. I don't know, either Corinne or Olivia. Corinne, you may have had this question at the Employers Council, and Olivia, you may have some insight on that as well.
Well, and I would just add that, this is one of those HR legal navigating pieces that we're in with COVID. And a good resource would be the Employers Council of Colorado. They have a great frequently asked question or blogs from lawyers who do deal with employee law. And you should probably read through some of that to understand what are some of the questions you have to ask. If I require for this and I don't require for that, am I discriminating in any way? So there are some specific questions you need to ask yourself as an employer, and you should probably look at some of those resources that are out there. Sorry, Olivia, I think I cut you off.
No, I hadn't started speaking yet, and I would just reiterate what you said. Like, it is definitely a sort of policy and employer question that it's good to seek HR type advice about.
Yeah, and another example would be, while there are no travel restrictions to other states, this would be a question that's come up a lot in other sessions. If an employee comes back from Arizona or Florida or California or Texas, and you want to require them to quarantine, you can as an employer, but there are questions, there's a web of questions you need to ask yourself as an employer. Am I letting them know beforehand? Am I doing this for anybody that travels? Those types of things that you'll need to navigate as an employer as well. So there's public health law, but there's also your employer law side as well. So a lot of employers are covering the cost of the test if they're requiring the test. Just putting that out there, a lot of them. Some employers are bringing in testing places like the Boulder Community Health or UC Health to do tests at the business and covering the cost. Are there any other questions out there? Is there anything else you guys want to add to those? I saw Mary laugh through some of those questions, like, oh, somebody else want to answer that? Are there any other questions out there? Anything you guys want to add at this time? All right, I'm going to ask you to put on your crystal ball, magic hat, whatever it is, at this point, magic 8 ball. Are we going to be doing temperature checks and screenings for a while still?
Definitely.
Yes.
Yes.
As we enter flu season, especially in addition to COVID, you know, anybody with flu, that's also a highly transmittable disease.
Yes.
All right, I'm just waiting. Just want to give it a second to make sure there's no more questions on the Q&A or the chat or my email. But I think we covered a lot of the hot topics from this week. Again, there's the contact information up there. Do not hesitate to ask questions, to reach out. If you have questions about, you know, outbreaks, an employee and a customer testing positive, ask them. And like I said, you've got a partner in Boulder County Public Health because they don't want to see the transmission either. We are switching. Oh, Mary, will you go back a slide?
Sure.
All right, so I'm going to give my little spiel that I've been giving at the end. We are switching to a new schedule starting next week, Wednesdays at 3 p.m. for all industries. But just because it doesn't say outdoor rec or personal rec or, you know, training or personal services or limited healthcare does not mean it's not designed for you. Get your questions answered, find out the updates, get the latest Boulder County trends, find out the information you need to be successful as an employer and as a business owner with customers coming in. So we will be doing a general update. And then if there are any changes that are specific to an industry, we will do ad hoc special sessions. So we set aside a time on Wednesdays just in case. But if something comes in on Thursday and it's a pretty hot topic and we will send you an email and say, here's the updated information for your industry. And we may convene a session just so that we can update you. So just know that we're going to continue to do industry specific information as it comes out, but we will have, we just want to make sure we continue to have opportunities for you to ask your questions, get information, and provide us feedback. So with that, we have no more questions. I want to thank Mary, Olivia, and Jesse. This is our last 4 hours in a row day for a while, hopefully. I don't mind doing it, it's just that hopefully we don't have a lot of changes that require us to go back to the schedule. And I want to thank Boulder County Public Health for being our partner, being the business's partner in successfully reopening in a safe manner. We'll see everybody next week and have a great rest of your week.
Thanks, Corinne. Thanks, everybody.
Thank you, everyone. Have a great afternoon.